If you have spider or varicose veins, you're not alone. While some vein issues, though, are simply cosmetic, others can actually be life-threatening.
We're learning more about the Spectrum Health Vein Center in this week's Medical Moment.
Are those odd-looking veins in your legs normal, or are they something to worry about? Dr. Jennifer Watson, a vascular surgeon with Spectrum Health Medical Group, explains.
Everything from small spider veins that may be more of a cosmetic concern to blood clots. You may have heard of them as DVTs that can be very life-threatening and serious.
The U.S. Department of Health and Human Services estimates that 50 to 55% of adult women face abnormal leg veins, 40 to 45% for men. That's why Dr. Watson says it's wise to pay attention, because it's not just about how veins look.
DVT is deep venous thrombosis. It is a blood clot, and it's a blood clot in a deep vein, which are the kind that we consider serious.
Dr. Watson says her patients are also seeing the impacts of COVID-19.
When we think of COVID, we think of the cough and some of the respiratory issues that people have, but it's actually very pro-inflammatory. So whenever you're inflamed, whenever you're sick or dehydrated, you have an increased risk of blood clots. So we see more blood clots, unfortunately, with COVID.
That's why she says it's important to maintain routine doctor's visits and do everything you can to stay healthy.
Being as mobile as you can, normal weight, regular exercise, no smoking, all of those good lifestyle things.
Varicose and spider veins are another common issue Dr. Watson sees. She says there are many contributing factors, including pregnancy, sun exposure, lack of movement, even your genetics.
All of these terms are just terms for veins with little valves inside that are not working well. So the blood is pooling or staying in the same area longer than it should.
Dr. Watson says the most important part of preventing vein issues is staying active. But if that's difficult during the day, there are other things that can help.
If you know you have a job where you are very immobile, getting those compression stockings on while you're at work, even, if you just wear them through your workday and then take them off at the end of the day, it gives you a lot of support during the day.
Some of the exercises Dr. Watson suggests include walking, biking, swimming, an elliptical machine, basically anything that activates your calf muscles. And if you're concerned about your vein health, Spectrum offers free screenings through their vein center.
We check a few of the spots we know are usually the worst for these veins, and then we can get a sense, is this really your veins causing your symptoms or not?
Now, the address and phone number for the Spectrum Health Medical Group Vein Center are right there on your screen. For more information, you can visit veincenter.spectrumhealth.org.
More news added.